Well, total knee replacement is a major operation. The good news is because we do take, most people don't want to know this, but we take an instrument and cut the ends of the bones. So, kind of like a, dentist, going back a dentist analogy, it's kind of like a dentist burring off the edge of the tooth. So that is really what I like to consider a pain provocative experience. That's the bad news. The good news is actually that pain is exceedingly well controlled with modern what we call multimodal pain management and using intraoperative blocks as well as spinal blocks as well as nerve blocks in and around the knee at the time of surgery and a multimodality management regimen. The actual initial pain of surgery has been largely not eradicated but largely managed, and so people having the experience of waking up in severe pain and not being able to move and stuff like that are is pretty rare in this day and age. So even though it's potentially a very violent procedure and pain provoking, the initial pain of surgery is not really a major impediment to surgery anymore like it used to be when I started practice. The bigger issue related to pain is the muscle pain in the recovery process. So there's kind of three sources of pain. The first source is the pain of surgery. The second source is the pain from inflammation a couple or 2 or 3 days later when the body's responding to the trauma. Much like if you get a paper cut, it hurts, but then 2 or 3 days later, you notice it's red and inflamed when you're in the kitchen, cutting lemons or onions or something. There's an inflammatory response that occurs about 48 to 72 hours after surgery that creates some pain that's usually usually well managed with oral medicines, but certainly is one of the more significant pains in the postoperative course. But the third pain, and the one that's most common, is actually the muscle pain associated with simply moving the knee. The knee's a hinge, and after surgery, hinges have to be moved or they stiffen up. And the muscles are the prime thing that keeps people from moving. And the muscles are also, even though, like when I perform the surgery, I don't cut the muscle, the trauma related to exposing the bone irritates the muscle, and the fluid inside the knee irritates the muscle. So the muscle doesn't want to move. And so it tends to cramp up or tighten up. And overcoming that cramping and allowing and getting the muscle to move so the knee can bend is probably the most persistent source of pain after surgery. And that really is in the first 6 weeks. After that, there's muscle pain related to strengthening. Most people can manage that one, but the pain that's variable from patient to patient, but also is present the longest, is simply the muscle pain from moving the knee.